Welcome to what you need to know about the ACA for the week of October 6th through 12th, 2014. My name is George Bouncer, and I'm the CEO of Spring Insurance Group. There will be more health insurance options on the federal and state exchanges in 2015. The Department of Health and Human Services announced last week that there are 77 new carriers participating in and offering plans on the exchanges next year. That's a 25% increase from 2014. Open enrollment begins on November 15th, and that will allow individuals to go back in and reaffirm and re-enroll or make adjustments to their plan choices starting in 2015. The announcement that 77 new carriers will participate in gives more options to people as they make their selections for 2015. In Massachusetts, United Health Plan will be offering plans for the first time in the marketplace for 2015. United has become a much more involved player in the space and is making the push nationally to be part of the exchanges now and in the future. HIPAA certificates are no longer needed nor required. Medical plans will no longer be required to provide certificates of credible coverage. In the past, certificates of credible coverage showed that a person had previous credible coverage in order to reduce pre-existing condition restrictions. The ACA prohibits the use of pre-existing condition criteria for most types of health coverage. Thus, there is no need for these certificates going forward when the change was made. Qualifying event requirements for plan enrollment outside of open enrollment. Plan sponsors are responsible to apply their qualifying event eligibility rules. Documentation from employees required to prove qualifying events. The following are a few examples of qualifying events. Employment status change, for instance, from part-time to full-time or vice versa. Marital status change, the birth of a child, death of a family member, relocation, expiration of COBRA benefits. All these can initiate open enrollment via a qualifying event. The PCOR Fee Adjustment, Patient-Centered Outcomes Research, PCOR or PCOR fee has risen from $2 to $2.08 per covered life for plan years ending on or after 10/1/14 to 9/30/15. The PCOR is set up to fund research into how to deliver health care that is more efficient, effective, and affordable. Insurers pay PCOR fee except in cases of self-funded plans where employers would pay the fee. The fee only applies to non-exempted benefits and is due by 7/31 of the following calendar year after plan end. A new CEO for Healthcare.gov was named in September. Kevin Counihan started as the new CEO of Healthcare.gov on September 8, 2014. Counihan joins the Federal Exchange after overseeing Access Health Connecticut, Connecticut State Exchange, and a stint at the Massachusetts Health Connector. Focused on improving site performance and making it more user-friendly, along with implementing a broker partnership arrangement similar to successful implementation in Connecticut, are some of the challenges that face Counihan as he takes over the reins at Healthcare.gov. For those of you who recognize that name, Counihan was not only the Access Health CEO in Connecticut and Chief Marketing Officer at the Health Connector here in Massachusetts, but he was also an executive at Tufts Health Plan for many years. So he has a real insight on how the carrier market plays, how the insured market, and is very connected with brokers and their role in the exchanges on an individual basis, on a group basis, and will provide some real clarity and comfort in a lot of ways to the future of Healthcare.gov, to many of the states who utilize the federal marketplace of the market exchange. That's a quick update. Contact us with any questions. Phone number is 800-821-6033, or email us at insight@springgroup.com.